My name is Sharon and I'm the Senior Sister. On behalf of the team, I'd like to welcome you to the department where you will receive your anti-cancer treatment. I hope your visit will be as comfortable as possible. If you have any questions, please speak to a member of staff. Alternatively, my contact details are available on the unit.
Hello. The aim of this video is to provide you with essential information to recognise and help manage any side effects whilst undergoing anti-cancer treatment. We will also talk to you about when you need to report side effects to us on the 24-hour helpline. Anti-cancer treatment includes chemotherapy, immunotherapy, targeted therapy and hormonal therapies. You may be receiving more than one of these treatments. Anti-cancer treatment may be in the form of a tablet, a small injection under the skin, or through a small cannula into the vein. If your treatment is in tablet form, please make sure that you wash your hands after you've touched the medicine. You will have had a discussion with your doctor about the benefits and side effects of your treatment. Please be aware that this does not mean that you will experience all the side effects that are talked about in this video. Your doctor may have recommended your treatment is given through a central line, such as a peripherally inserted central cannula, also called a PICC line. If you are having a central line for your treatment, we will talk to you separately about how to look after your central line and arranging blood tests. Thank you for watching.
We encourage all patients to have flu, COVID-19, shingles, and pneumococcal vaccine. When you're on anti-cancer treatment, you should not have live vaccines. Please ensure if you have the shingles vaccine, it is the non-live vaccination, as there are two types. Ideally, vaccination should be given 2 weeks before starting treatment or within 72 hours after any treatment. Please contact your GP surgery to arrange this. If you have any questions about this, please speak to your doctor. Anti-cancer treatment can make you feel tired for a number of reasons. Fatigue can be described as an overwhelming tiredness even if you have slept. It is best managed by trying to stay as active as you can during the day whilst having regular breaks. Exercise is known to help with fatigue. Gentle exercise like walking can be beneficial. Please talk to your nurse or doctor if you need some support with fatigue. If your fatigue is severe and you're spending more than half the day resting or sleeping, please call us on the 24-hour helpline.
Anti-cancer treatments can sometimes affect your skin. If you experience any problems with your skin, such as pain, cuts, swelling, itching, peeling, blisters, rashes, or anything unusual, please call the 24-hour helpline for advice. However, there are some measures that you can take to minimise the risk of damage to your skin. Firstly, inspect your skin daily. When doing this, make sure you observe the skin on your hands and feet for signs of anything unusual. When washing daily, you should use lukewarm water and gentle, unperfumed, uncoloured soap-free cleansers, body washes and bath products. If you have a shower or a bath, you should avoid very hot water. It is important to keep your skin moisturised using unperfumed, gentle products. After washing your hands or feet, make sure that they are dried well, especially between your fingers and toes. It is also important to cut or file your toenails straight across. When choosing socks, materials such as cotton or wool may provide additional comfort. You should also be mindful of other factors that may cause irritation, such as large seams or tight-fitting socks. You should wear comfortable and well-fitting footwear and avoid walking barefoot or on uneven surfaces. Walking for prolonged periods of time may cause trauma to your feet. If you have any pre-existing concerns about your feet, it may be useful to visit a podiatrist before starting any treatment. When gardening or doing household tasks, wear gloves to protect your hands. In the winter months, wearing gloves outside can prevent dryness and cracks in your skin. It is very important to protect your skin from the sun. Please read the leaflet about this in your new patient folder. Anti-cancer treatments can sometimes give you a sore mouth. You need to take care when brushing or flossing your teeth. It is recommended to use a soft toothbrush. If possible, it is advisable to go for a dental checkup before starting treatment. Should you require any dental work whilst on treatment, please contact the 24-hour helpline for advice. If your mouth is sore or you experience mouth ulcers that are stopping you from eating and drinking normally, please call the 24-hour helpline for advice. Please read the Care of Your Mouth leaflet in your new patient folder for more information and advice.
Some, but not all anti-cancer treatments can cause you to feel or be sick. We have medications that can help manage this. You may be given some anti-sickness medications before starting treatment and to take home if required. Please be aware that if bodily fluids such as vomit come in contact with skin or clothing, small traces of anti-cancer drugs can be present. Clothes will need to be washed at twice the normal recommended temperature, and skin will need washing with cool water to the area affected. It's important to keep well hydrated. Please contact the 24-hour helpline if you have a significant decrease in eating or drinking as a result of feeling sick or 3 to 5 episodes of vomiting in 24 hours. Some anti-cancer treatments can affect your bowels. This may include constipation, bloating, and passing more wind. Some common signs of constipation can be when your poo is harder, you're straining to have your bowels open, or your tummy is becoming bloated or uncomfortable. It's important you keep well hydrated if you experience any constipation or diarrhea. If you've not had your bowels open for 72 hours or any of the symptoms mentioned, please call the 24 hours helpline. If you are having 3 or more episodes of diarrhea in 24 hours, experiencing pain, cramping, or any bloody discharge, please call us on the 24-hour helpline.
Hair loss or hair thinning can be a side effect of some anti-cancer treatments, which can affect the hair on your head or body. This can be distressing, but is usually temporary. Sometimes hair can grow back a different texture or color. Depending on your anti-cancer treatment, you may be offered scalp cooling. This can help reduce your hair loss. If you are eligible for scalp cooling, this will have been discussed with you in the clinic and more information will be given to you. Some patients may choose to have a wig or hair covering. Please refer to the leaflet in your new patient folder on how to apply for a wig if this is something that applies to you. If you are pregnant, breastfeeding, or if you become pregnant while having anti-cancer therapy, then please inform us as soon as possible. If you feel well, it is fine to have sexual intercourse during anti-cancer treatments. Small amounts of the treatment drugs can get into your bodily fluids. This includes fluid made in the vagina and fluid containing sperm. To protect any partners, it is advisable that during all anti-cancer treatments and for a few days after, you use a condom. It is important you use contraceptives to avoid pregnancy while having anti-cancer therapy and for 6 months thereafter, as this could harm a developing baby. Your doctor can give you more advice about suitable contraceptives. Anti-cancer treatment can affect fertility or can cause an early menopause, so you may want to discuss this further with your doctor. We may ask you for a pregnancy test on the day of your anti-cancer treatment, if appropriate. This will be carried out on the unit.
Some anti-cancer treatments are given into a vein. To access the veins, a cannula, PICC line or central line will be used. your doctor or nurse will explain more about these. Very rarely, the anti-cancer drugs can leak around the vein being used and into the surrounding tissues. This is called extravasation. Symptoms can occur during the treatment or several hours or days following the treatment. If you experience any burning, stinging, pain, redness or swelling around the administration site during your treatment, it's very important that you inform us straight away. If you experience any of these symptoms at home, then please call us on the 24-hour helpline. In the rare event of this happening, there is some treatment that we would need to carry out to the affected area. As mentioned at the start of the video, there are many types of anti-cancer treatments. What we have discussed so far is relevant to anyone receiving any type of anti-cancer treatments. However, in the next two parts of the video, we are going to be providing some additional advice specifically for patients receiving immunotherapy or chemotherapy, or if you are receiving both of these anti-cancer treatments. First, we will talk about immunotherapy. You will know if you are receiving immunotherapy, as you should have had a discussion with your doctor in the clinic. Today, you will be given some paperwork that will have a yellow round sticker on it. This sticker will indicate that you will be receiving immunotherapy. You will also be given a yellow and white immunotherapy alert card that looks like this. On the back of the card, there is a list of potential side effects for immunotherapy treatment. Immunotherapy can cause inflammation in different parts of the body, which may cause these side effects. Organs or tissues can be affected, but most commonly the skin, bowels, lungs, liver and endocrine organs like the thyroid gland can be affected. Side effects include diarrhea, shortness of breath, a new cough, yellowing of your eyes or skin, fatigue, feeling more thirsty or experiencing severe muscular aches. You do need to read the back of your immunotherapy alert card for more information about these side effects and when to call us on the 24-hour helpline.
We will now talk about chemotherapy. You will know if you are receiving chemotherapy, as you should have had a discussion with your doctor in the clinic. If you are receiving chemotherapy, the risk of infection is one of the main side effects. Chemotherapy can reduce your immune system, therefore increasing your risk of infection. Some patients may be given a box of small injections to take home and use for a few days. These are administered under the skin and help the immune system. This is something your doctor or nurse will discuss with you if it is required. Some patients may require a blood transfusion due to the chemotherapy causing a reduction in red blood cells, otherwise known as anemia. If you experience any shortness of breath or fatigue that is not normal for you, or dizziness, please contact the 24-hour helpline. Some chemotherapy may cause a reduction in platelets, which help clot the blood. You may require a platelet transfusion. If you experience any blood loss or changes in your skin, which is new to you, please contact the 24-hour helpline. If you are receiving chemotherapy, you will need a thermometer at home, so you are able to check your temperature. You do not need to check this daily, but you should if you feel unwell. You will be given a red chemotherapy alert card that looks like this. On this card, you will see the 24-hour helpline phone numbers. You must contact the 24-hour helpline immediately if you have the following symptoms. If you have a temperature of 37.5 or above, or a temperature of 36 or below, feel shivery or flu-like, feel generally unwell, including side effects that are not minimal or manageable. If the line is busy, please keep ringing. Your call will be answered. The nurse will ask you a variety of questions. Some may not feel relevant, but this information is important for us to make a full assessment. You may be asked to attend the hospital, see your GP, or be given other advice. If you are asked to attend the hospital, please bring your pants card. On arrival, please immediately hand your pants card to the nurse or doctor looking after you. This card will ensure you receive antibiotics in a timely manner. There are also some self-care tips that can be adopted to reduce your risk of infection. These include good personal hygiene, making sure you wash your hands with soap and water, especially after using the toilet, gardening, handling pets or before preparing food. You should try to avoid handling animal waste such as litter trays or manure. You can use hand gel if you're not able to wash your hands at the time. You should have a shower, bath or wash daily and avoid sharing towels and flannels. Try to stay away from people with infections such as COVID, chickenpox, shingles, flu, diarrhea or vomiting. If you've been in contact with anyone who has these infections, please call the 24-hour helpline for advice. There is an increased risk of infection in large groups of people. Avoid crowded places where possible. There are some foods that you should avoid eating. It is important that you read the food safety advice leaflet in your new patient folder for more information about this.
This final section is now applicable to all patients receiving any type of anti-cancer treatment. Before leaving the unit after each treatment, there are 5 things you need to take home with you. Firstly, any medication prescribed to take home, the pharmacist or the nurse will explain these to you. Secondly, your next anti-cancer treatment appointment letter. Additionally, you need your treatment record book, which the nurse will update and can be found in your new patient folder. You also need to take a blood test request form that you will need to take to your next blood test, which is prior to your next appointment in the unit. And finally, a car park ticket is required. You can get this from the nurse or at the admin desk. Thank you for watching this video. We hope it has been helpful. Please remember to read the information in your new patient talk folder. Please remember we are here to support you, and any further support can be found by reaching out to your clinical nurse specialist, whose details you will have received at your consultant appointment. You can also get support from the personalised care team and the Macmillan Cancer Support. Their details can be found in your new patient talk folder.